Okay, so here is the lecture on language and intelligence. Key terms for this section, just one, aphasia. There are a few anatomical terms that we'll add here. Broca's area, Wernicke's area, and the planum temporale. And you should be able to accomplish these learning objectives. Describe a split brain procedure and how they've contributed to understanding of lateralization, which hemisphere is dominant for language. Talking about the profile of Broca's and Wernicke's aphasia, and talking about intelligence. Language and intelligence are often discussed in the same vein because they're closely related, but we'll talk about a couple cases in which they're distinct, and we'll touch briefly on dyslexia. So, split brain patients, they've contributed a lot to our understanding of lateralization of the brain and language functions, where language functions are localized. So the corpus callosum in split brain patients is severed. Now, this is done to relieve epilepsy, refractory epilepsy, after medications and other. This is kind of a last resort kind of an option if all other options have been expended. Interestingly, cutting the entire corpus callosum doesn't impair someone's function to a large degree. There are very subtle differences that the patient may not even really notice. It's important to note that the corpus callosum is not the only connection between the two hemispheres. There are some other ones, the anterior commissure, the posterior commissure, for example. But the corpus callosum is the main one. And typically just severing that is sufficient to relieve epilepsy, and sometimes not even all of it. It needs to be cut. But just know that there are some ways in which information can still get from one hemisphere to the other. So there are some limitations to these split brain studies that we'll discuss. One area in which performance is improved is tasks that involve one side of the body doing something independent from the other side, like drawing a square with one hand, drawing a circle with the other hand. Split brain patients tend to outperform patients, controls with intact brains in a task like that. I'll post a link to this video. This is a little video about a split brain patient named Joe, and just showing some interesting distinctions between the two hemispheres, notably in language production. If a stimulus is presented to one hemisphere versus the other, remember how the visual pathway is laid out, where anything presented on the left side of space, the left visual field goes to the right hemisphere, and things presented on the right side of space go to the left. And typically only one of those hemispheres, the left, is able to talk and then express verbally what was seen on that side. So this shows some tasks that exploit that. So as I mentioned, the left is dominant for language. There are some anatomical asymmetries as well in language-related areas. The planum temporale is this area on the ventral surface of the temporal lobe, and it tends to be larger on the left than the right. The left also sometimes is called the interpreter, as it's able to verbalize, it's involved in reporting actions and reasons for actions. There may be things that the right hemisphere is executing and the reason is not fully known, and so the left hemisphere in these split brain patients will come up with a creative explanation and interpret why that action is happening. The right is dominant for other functions, It appears to be dominant for spatial relationships, emotional responsiveness, such as picking up on the tone of someone's voice, whereas the left is dominant also for language comprehension. The right hemisphere does have some language-related functions, one of them picking up on what's called prosody, or the how someone says something, whether it's good job or good job. So be cautious of overstatements as well. There's a lot of pseudoscience and claims that are overstated regarding lateralization. It gets a lot of talk in the popular press. So things like, right-brained people are more creative, or I'm left-brained, or I'm right-brained, so I can't do math. Those are reaching a bit too far, even though there is evidence for functions that are somewhat related to creativity. That's not something that you can really conclude. And typically, both hemispheres are going to be engaged in most tasks that are performed. And remember, if you have an intact corpus callosum, then information is being transferred around. And so you're not going to have like one hemisphere that's performing a task independently, an art task or a math task, for example. So depictions like this are not very well supported at this point. Just as an FYI, this is an example of the interpreter role. So a split brain patient, I believe it was Joe who's shown in the video, was shown this picture, and these pictures are flashed briefly on a screen so that the image only gets to one side of the brain. So, I mean, if you move your eyes, you can present it to both visual fields, and so it'll get to both sides. But if it's just presented briefly, it'll just get to one. And the scene over here went to the right hemisphere, which is non-speaking, and this image went to the left hemisphere, which is speaking. Okay, and then remember, the left hemisphere controls the right hand. So since this image went here, he was supposed to point to pictures that related to the images. He pointed to the chicken, and then this scene he pointed to the shovel. Now the right brain pointed here because it's a shovel it's a snow shovel, right? However, what he said when asked, why did you point to the shovel, the right hemisphere couldn't verbalize that, and so the left hemisphere came up with a creative interpretation. Oh, I need the shovel to clean out the chicken coop because there's chicken poop everywhere in the chicken coop. All right, intelligence. So intelligence is defined as an underlying factor that explains performance on a variety of tasks, kind of this common thread that explains performance on a wide variety of tasks. One term for intelligence, or that's used to symbolize intelligence, is G. That's lowercase g, and that's G for general intelligence. That it's something that allows you to perform on a wide variety of tasks. That common trait. Language abilities typically will correlate with intelligence within a person, and when you're talking on the species level too, we as humans are, well, at least we consider ourselves to be the most intelligent, and we also have the most advanced language abilities for sure. So the question then follows, perhaps language is just a byproduct of intelligence. There's evidence that suggests that's not true, and that's found in Williams syndrome and genetic language deficiency. Williams syndrome, individuals with just this genetic disorder have difficulties with many tasks. They have intellectual impairment in various domains, but their language skills seem to be quite intact. Usually individuals with IQ scores on that level also have difficulty with language, but individuals with Williams syndrome tend to be very fluent in language. They also have strengths in music abilities. They're often very good at music. Genetic language deficiency. There's an example of a family who scored high on other intelligence tests, but just had a very specific deficit in language. So there are cases in which, on both sides of this, that language and intelligence can be distinct, suggesting that it's not just a byproduct. Language is not just a byproduct of intelligence. Here's your two anatomical areas. Notice these are both on the left hemisphere. Broca's area in the frontal lobe. It's the left inferior frontal gyrus, technically. And Wernicke's area in the posterior superior aspect of the posterior temporal lobe. This table summarizes the two aphasias, Broca's and Wernicke's aphasia, which the aphasias describe the symptom profiles, but they tend to be associated with damage in those two areas. Broca's aphasia is a deficit in speech production. Wernicke's aphasia is a deficit in speech comprehension. The speech is just very, in Broca's is very belabored. It's called telegraphic because there's a lot of connecting words that are left out. So it's kind of like you're sending a telegram, and you don't want to, when you sent a telegram back in the day, you didn't use quite so many words because they cost money, and so there's a lot of grammatical connectives left out. And sometimes comprehension is impaired in certain scenarios with Broca's as well, but it's especially impaired in Wernicke's aphasia. And because individuals with Wernicke's aphasia aren't understanding what they're saying themselves, their speech sounds just nonsensical, kind of word salad, and sometimes it's manifest in difficulty finding the names for things and finding the right word. But they can speak fluently. They have no trouble talking. It just doesn't make sense. These two videos I'll post as well. That gives you some examples of what these actually look like in some patients with these aphasias. So damage does underlie the aphasia, but it might not be that exact area. These aphasias, what we just discussed, those profiles describe the symptoms. And usually it's damage beyond that area. Strokes tend to be messy. Just briefly about dyslexia, an interesting deficit in language. This is where a specific deficit in reading, when things like vision, motivation, cognitive skills, educational opportunity are adequate. Of course, those are other factors that could explain difficulty with reading. These are just some people who have dyslexia, just to illustrate that you can still have a very successful career in life despite having this disorder. And it's also manifest in different ways. Some behavioral hallmarks. Sometimes it's trouble sounding out words. Sometimes it's failing to recognize words as a whole, detecting temporal order of sounds, just auditory memory. And sometimes it's manifest in heightened attention to letters on the right side to the right of foveal vision. So if you are asked to look at this middle line and identify the letter here in the middle, if you're keeping your eyes fixed here, it can be harder as it gets more distant to identify what that letter is, but someone with dyslexia would actually be able to outperform somebody without. And these are just some biological hallmarks, some hemispheric asymmetries, and weaker than normal connections between auditory and Broca's. Okay.